Health Minister Joe Phaahla has led the reopening of the Accident and Emergency Unit at the Charlotte Maxeke Academic Hospital here in Johannesburg. Phaahla expects repairs to the rest of the building to be completed by December of 2023. The two units are part of a phased-in approach to rehabilitate the hospital, which was gutted by fire more than a year ago. The National Health Department took over the repair project of the facility in an effort to speed up the rebuilding, which has continued to fumble over its own deadlines.
And we'll do everything in our power to make sure that it's not extended any further. So the timelines which we have set, as we are today able to say the accident and emergency is functional, all the other timelines, we intend to make sure that we follow our commitments and come by the end of next year that the entire hospital will be fully functional.
Let's talk more then about that story with the Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, always good to have you on Newzroom Afrika. So how much will the opening of these two units at Charlotte Maxeke, the reopening that is, go as far as alleviating pressure on the other facilities in the province, such as Helen Joseph, which had been bearing the brunt since the fire?
Good afternoon to you, Tembekile, and good afternoon to your viewers. Really, I think it is a good, an acceptable step in the right direction. We think that, this is long overdue. You will know that our colleagues have been suffering quite a lot in terms of pressure on the resources in other hospitals, but also, pressure on our members, doctors in those places and other healthcare workers who were standing, absorbing pressure from Charlotte Maxeke Hospital. This is going to go, a little bit, but we know that there are still other areas that need to be attended to. But we welcome, the opening of these sections.
And let's talk about the sort of people who would present in these two units and what the experience has been of your members having to treat these people elsewhere in Gauteng.
What is happening is that when they come, there will be congestion. Obviously, as you know, when it comes to accident and emergencies, congestion, but also you don't have enough beds, to admit those patients. Hence, at times, you'd find patients lying on the floor and all those things. I'm not saying that was something that was acceptable, but I'm saying it caused problems to the surrounding institutions. So that is why we really say that government should be on top of these renovations and repairs, because it is going to cause problems for the healthcare workers and also for the department itself, especially in the Gauteng area.
So these are just two units. The DA's Jack Bloom has been saying that what we now need to press for is faster work to happen to reopen the rest of Charlotte Maxeke. Cancer patients, for example, are still on long waiting lists as a result of the damage caused by that fire. You've got other people who also are suffering serious illness who do need urgently to be treated in a space that is less congested than, say, Helen Joseph, which we know is under more pressure directly as a result of what happened at Charlotte.
Exactly. You know that if there's a delay in terms of cancer treatment, the disease is not waiting for repairs and all those things. It continues to ravage the patient. So it's very important that we take that into consideration, noting that those people who went to other hospitals, they joined a queue there. It's not like people were waiting for them. So it's important that the Department of Health in that area, they make sure that they speed up reopening of other sections of the hospital. It's very crucial for the health of the people and the communities in that area.
With that in mind, then, the target to complete all renovations, all repairs at Charlotte Maxeke by the end of 2023, is that acceptable when you consider the pressures around the oncology services in Gauteng? Psychiatric care has also apparently been compromised to some degree.
Well, it's mind-boggling, to find that the Minister of Health can tell the nation that that hospital will be ready at that time. We know in other countries like China, where we know that a hospital is built within days. You're talking about a a country that is ready to run the national health insurance, they can't even manage one hospital. I mean, this is really, to me, not acceptable. So I do think that it's a failure of government when it comes to, the communities in Gauteng to be giving those timelines. They're not acceptable at all.
What is the incentive then of health workers in Gauteng to take up posts in public health when you consider the various challenges where hospitals are either under-resourced or you're dealing with a patient-doctor ratio, patient-nurse ratio that is to some degree, shall we say, unfair?
Well, they might be kept in that province for other reasons. Some people have got their kids, they have got their partners, working in Gauteng and all those things. They might be kept for those reasons. But there is nothing that really attracts healthcare workers to remain in the province when the province is failing, to deliver on the very basic conditions of employment, where you find that there's unnecessary pressure, that healthcare workers must absorb on top of, having gone through the waves of COVID-19. So it is very insensitive of the department to be having other institutions like Charlotte Maxeke who are not functioning well. And I don't think that it is going to help the mental health of healthcare workers.
Dr. Mvuyisi Mzukwa from the South African Medical Association, always good to have your time, so thank you.